Adderall versus Ritalin. What's the difference? Treating ADHD. In the United States, 9.5% of children between the ages of 3 years and 17 years have been diagnosed with attention deficit hyperactivity disorder, or ADHD. ADHD isn't just for kids, though. According to the Anxiety and Depression Association of America, about 60% of children with ADHD will still have symptoms as adults. People with ADHD have trouble concentrating and controlling impulses. They may be fidgety and excitable. Doctors often prescribe stimulant medications to people with ADHD. Two common choices are Adderall and Ritalin. These drugs can help people concentrate and focus on tasks better. They also reduce impulsive behavior, which is another hallmark of ADHD. Adderall and Ritalin work in similar ways to treat ADHD. They also share some of the same side effects. However, they have important differences. We'll explain the basics of both drugs. Drug features. The generic name for Adderall is amphetamine and dextroamphetamine, while for Ritalin it's methamphetamine. There are generic versions for both of the drugs, Ritalin and Adderall. What are they used for? Both are used to treat ADHD and narcolepsy. They both come in short-acting tablets and long-acting capsules. And it comes in different strengths for both medications. So for starters, the Adderall tablets come in 5 milligrams, 7.5 milligrams, 10 milligrams, 20 milligrams, 30 milligrams, and Adderall XR extended release comes in 5 milligrams, 10 milligrams, 15 milligrams, 20 milligrams, 25 milligrams, all the way up to 30 milligrams, while Ritalin or methamphetamine tablets come in 5 milligrams, 10 milligrams, and 20 milligrams, while the Ritalin long-acting capsules come in 10 milligrams, 20 milligrams, 30 milligrams, 40 milligrams, and 60 milligrams. The typical length of treatment for both drugs is long-term. Both drugs should be stored at room temperature. They are both controlled substances. There is a risk of withdrawal from this drug or both drugs. And this drug has a potential for misuse? Yes, both do. How they work. Both Adderall and Ritalin are central nervous system stimulants, CNS stimulants. They work by increasing the availability of neurotransmitters, norepinephrine, and dopamine in CNS connections. This speeds up your brain activity. Ritalin works sooner and reaches peak performance more quickly than Adderall does. However, Adderall stays active in your body longer than Ritalin does. Adderall works for 4 to 6 hours. Ritalin is only active for 2 to 3 hours. This doesn't necessarily mean that Adderall is a better choice, though. Some people prefer the short-acting Ritalin because they can better control the timing of side effects such as loss of appetite and trouble sleeping. Cost and availability and insurance. Adderall and Ritalin are brand name drugs that are also available as generic drugs. Generic forms tend to cost less than the brand name versions. In general, Adderall and Ritalin cost about the same. The amount you pay for the drugs will depend on your health insurance plan. Some health insurance plans only cover the generic versions of the drugs. If you're unsure, you can call your insurance provider to find out the specifics of your plan. Adderall and Ritalin are usually available at most pharmacies. However, these drugs can have shortages, so they may not be available at all times. Call your pharmacy ahead of time to find out if your medication is available. Some of the side effects. Since both drugs work in the same way, these drugs cause similar side effects. Common side effects for both Adderall and Ritalin include trouble sleeping, loss of appetite, dry mouth, anxiety, increased heart rate, irritability, headache, and dizziness. Some serious side effects shared by both medications can include addiction, heart rhythm problems, psychosis, Raynaud's syndrome, slowed growth in children. Making a decision. According to a review of studies spanning 40 years, stimulant medications are effective in treating 70 to 80% of children and adults with ADHD. The general recommendation is that one of these drugs doesn't work for you, you should try the other one. With that being said, there are some minor differences between the two drugs, such as how quickly and how long they work in your body. Work with your doctor to find the best drug for your ADHD. Thanks for watching, guys. Once again, this has been Adderall versus Ritalin. What's the difference? Hope you enjoyed the video. Drop a like, drop a comment down below, and make sure you smash that subscribe button. Stay tuned for more content to come, guys. As always, cheers and ciao. Peace.